when you're looking at veneers, there is a huge range of cost and literally they can go from 1,500, the ones that are 800, I'll kind of explain that, but 1,500 up to $5,000. Like there's a couple of dentists in New York that have built such a fantastic reputation on what they do. The one guy that I know of, he's got a place in LA, he's got a place in Miami, he's got a place in Dubai, he's got the place in New York, and he flies back and forth, and he's trained other dentists to do that. And they have a lab that's built, that's on their facility, that custom makes everything. So when you're looking at, it's not like going to the grocery store and there's Crest at this store and there's Crest at that store, but this one's got it for $2 and this one's got it for $1.50, whatever that is. It's not a commodity. So dentistry is nowhere close to a commodity. From when I started doing veneers 34 years ago, the cost back then, I think my veneers were $600 or something like that. Now they're more like $1,700 to $2,000, depending on how many am I doing. So that has a lot to do with it. Like I've spent years at getting better and going through training. Las Vegas Institute was one of the very first ones, American Academy of Cosmetic Dentistry. I've been involved with them for 30 years, and we have patients that come just because of experience. Now they paid a lot more for what they could have gotten kind of the first time. And I tell them literally when I have them in their mouth, I said, you are not going to hurt my feelings. I want you to tell me exactly what you don't like. We'll put you back in temporaries. We'll get the lab to correct the things that you don't like, and we'll bring you back and try them in again. So I think that's the biggest part. I've had a lot of patients, they set up, say, okay, we're done. And then they look in the mirror and they own them at that point. I'm like, why don't I? How do you get them off? You got to numb them and cut them all off again. And that's not something you want to, go through really. But the variance is obviously lab, the experience of the dentist, the technology. You can get like the 800, they're usually resin veneers, so they're made out of plastic or something, where anything over that, now you're getting high grade porcelain. And the higher grade, it's going to look more like a natural tooth. It's going to have translucency, reflect and absorb light like a natural tooth. It's going to be stronger. So all of those. So I think the biggest thing that patients, if you Google veneers, one of the first things is my veneers come off all the time. So if you over prep a tooth and you cut all the enamel off, like you were going to do a crown, you have to bond enamel. And what I tell patients is whatever enamel I remove, I'm bonding porcelain to replace the enamel I remove. One of the biggest challenges is how do you remove questions when it comes to veneers? So our biggest goal is, and I'll tell you, a lot of dentists, their technique basically is that patient comes in, they want veneers, they bring them back, they prep their teeth, they use a pre-impression model to be able to make their temporaries off of, and then they hold up the shade like, what do you want to pick from, kind of thing, which one, and then that gets sent to the lab. And so the lab, the more information you can give the lab, this is all about like the design and the shape and the color and how do you have that patient kind of feel what the final ones are going to feel like. So what we do in our office before we ever start a case, even from the consultation, so the patient comes in, we're going to get like a full mouth of photos. So the photos are going to allow me to bring them up in front of them and start asking, like, what is it you don't like? Like, what are the things, what is driving you to want to do veneers? And a lot of times it's, I got spaces, I've got chips, my color, I don't like my color, I've got tetracycline staining, which is like an internal staining that it's very difficult to remove, so you have to mask that. And how do you mask that without that dark shade showing through still on veneer? Because you can make veneers like super thin. We want to make sure that we remove all the question marks. They get to test drive. That's what makes That's what makes it work. If you're just prepping and you're sending it to the lab, they're gonna make what they think looks right. Well, and it's always different to a certain degree, because once you put the temporaries in, now they're in their mouth and you get to see, because the lips frame, are the frame for the teeth, but so is the gum. So if something looks off, and that's where the same kind of thing I identify as the gum too long, is that why, or it's hanging down on this tooth, but it's perfect on the tooth. That's where we pull out the laser and kind of contour it and shape it to where now when they smile, you don't have one gum hanging down, one's up higher, because it makes the tooth look like it's short, but it's really the gum is too long. So we correct. I mean, we're looking at everything to where it's kind of, again, going back to what's the difference between, the veneer costing this amount of money compared to that, because my eyes are so trained that I'm looking at that too. I'm not just looking at the teeth. And, even with my associate, that's something that I've been working on, mentoring him as much as I can, to where he's like, oh, I didn't even look at that, and that's really the difference in the expertise of, gosh, I've been doing this a long time and I've made mistakes, and when I made mistakes, I made them on my own. I didn't have a mentor. But all the training that I went through, Las Vegas Institute is kind of the premier training ground for cosmetic dentists, and just all the other courses and everything. I mean, you're always striving to get better and all that. So that's where the cost difference comes in a lot too. Options for cosmetic dentistry, there's so many options, and so many of them can be very simple and very lowering the cost significantly. So there's what we call a smile sculpting, where let's say the teeth are just worn and they're worn uneven and one's longer than the other. So a lot of times we'll start with, let's whiten your teeth. That's always a huge, and that's not crazy expensive. You can contour the teeth and make them more even, contour the corners so they're not so square, those kind of things. So definitely that. There's always bonding. So you can bond, let's say a tooth you've got a gap between a tooth, or it's shorter, you can whiten the teeth and then come back and bond. And when you bond, you're going to match the new. I always tell patients, if you ever thought about whitening, you got to do that before we do the bonding, because if you do it after, now your teeth are whiter and the bonding is darker, because we just matched your darker teeth before you whiten them. So that's important. Then you can contour. I've even done patients where they're financially they're not able to do it, so we do bonding, we do some contouring, and they last 5 years or something. And in the meantime, they know what the costs are for the veneers. They start saving for that, and then when they've got enough money, or like we have interest-free financing, we've got a lot of options that for some people, you offer that to them and they find a way to fit it in their budget and their lifestyle. And now, hey, I didn't know I could do this. And that's a huge, everything now. You can do Affirm, you can do Cherry, you can do all these different interest-free that it makes sense to be able to do it. And people can afford $500 a month, but they can't afford $15,000 all at once, kind of thing. So we're always looking for options. I've even had patients that we've told them, hey, just keep paying. If you can pay $400 a month, if you can pay $300 a month, you start building up a credit with us. And we get to a point to where you can write a check for the rest of it, or put the rest of it on a credit card or whatever, and you're comfortable with it. Then you've already got $10,000, $5,000, $3,000, whatever it is, already saved. So we're looking for those, those options wherever we can. We do some give back a smile stuff too, where I've done makeovers on patients over the years where they're single dads. They have two young boys that he put them both through ortho, and they have beautiful straight teeth, but dad never had them. We've been on the show in Houston where we've done the makeovers, like the old show Extreme Makeover that used to be on television. So I put together a group to give back to the community, where we had a plastic surgeon, an ophthalmologist that did LASIK eye surgery, eyelid lifts, did full mouth rehab on patients, all at our cost, just to be able to get back to patients that, people that have really given of themselves for their kids or, whatever it may be. And we've done a lot of those over the years, and that's always fun and rewarding. But for those, for the other people, there's options, and we look for those, and it's just making it affordable however we can for them to, because the biggest thing and the most rewarding thing is even when you put the temporaries in on most of they're in tears, because it's always, they don't smile like this gentleman. People thought he was just kind of unsocial, and he was rude and everything else. And literally, he had gone through a divorce. He had his two sons, and when we did his makeover and his veneers and everything, he ended up getting married. I mean, his whole life changed just simply from, now he felt better about himself. He was more outgoing. Then another gentleman that just those kind of stories where he was a salesman. At the end of every event that they had like a cocktail hour. He would go back to his room. He wouldn't stay for the cocktail hours because he was so embarrassed of his smile. And he went to the next meeting after we finished doing veneers and everything on him, and he shot a picture and sent it to me, texted it to me, and he said, "I just wanted to let you know this is the first cocktail event I've ever gone to in 20 years. Thanks to you, because you recreated my smile for me." So that's what makes me get up and want to go to work every day, so, but yeah, it's pretty cool. I don't want to be the one, honestly, I don't want to be the one that talks somebody into doing veneers. I put it out there just like anything else. My job as a healthcare provider is, I'm going to tell you what's best for you health-wise, or to keep you from having a toothache or an infection or whatever that is. And then you do what you do with it. I mean, I have patients that don't come in, and then they call on Saturday night and they're in so much pain and they're swollen and everything else. But our job as being a licensed caregiver is, here's the problem, here's the consequences. With a smile and veneers and everything, I think they already know what the problem is, and their consequences typically they lack confidence, they don't smile, there's a lot of just lesser than in their head kind of thing. Like, we're going to do this, and they're going to be walking through, and in life, communication is what life is about. And that's where the biggest disagreements and all of that come from. And so for us, you want to cover all of those, answer the questions some of the questions they don't even have. So we're going to tell you, here's how the temporaries work, here's how the preparation is going to be, here's what all of this is going to be, here's your post-op stuff. And then, then the patient, now they can make an educated decision because they have all that information to go by.